what people worry about when they have an aneurysm, both doctors and patients, is what I would call an aortic catastrophe, but most would kind of think of some kind of aneurysm rupture. Okay, and it's interesting because most aneurysms in the ascending aortic position, they don't usually rupture as their major complication. They kind of partially rupture, they tear, and it's something called aortic dissection. Whether it's a frank rupture or aortic dissection, they're both terrible. They're surgical emergencies, and it's said that up to 90% of patients who experience this don't actually make it to the hospital. Of the patients who do make it to the hospital, it's one of the last few things that represents a true surgical emergency for cardiac surgery, and those patients get taken to the operating room as quickly as possible. Daytime, nighttime, weekend, doesn't matter, and the survival rates are probably on the order of 75 to 90%, depending on the place. So it's super important to get these aneurysms identified before they misbehave, and my own experience is that simply identifying the aneurysm and giving this counseling of what you should and shouldn't do when you have one is very protective. In one program that I used to run, even though I got a lot of credit for doing very complex and fancy aneurysm surgery, what I thought everybody should really be focusing on is the reality that we never actually saw aortic dissections, aortic catastrophes in patients who were already enrolled. Patients who were prospectively enrolled in the program, we never saw aortic ruptures. So I think just the simple knowledge of having this is very protective. Even though our guidelines tell us that we should be thinking about surgery when the aorta is over 5.5 centimeters in diameter, if you look at the worldwide data, what we'll actually see is that about 60% of all aortic ruptures, catastrophes happen at sizes less than 5.5 centimeters. About 40% of all aortic complications happen at sizes smaller than 5 centimeters. And about 20% happen at sizes less than 4.5 centimeters. So this can be pretty complicated data to match up to our clinical practice, and the spin really is that there are so many modestly dilated aortas. There are so many aortic aneurysms out there that are only in the 4.5, 4.7 centimeter range that we really think that very few of them are a rupture. So it's kind of a numerator-denominator problem, and we don't want to operate on all of these because we don't want to introduce risk to patients whose aneurysms aren't actually a risk of rupture. So the trick for those of us who are involved in aortic research around the country and around the world is to try to find better risk systems for aortic aneurysms than these size rules that we have. And I think we're going to make a lot of progress over the next several years to really try to get to a more scientific understanding of who's truly at risk.